Hi, I'm George. I'm from the FITS on the Go team, and we're here at ACC 2014 in DC, and we have the opportunity to have some minutes with Dr. John Mayer from Harvard, from the Children's Hospital. And Dr. Mayer, thank you very much for taking the time to talk to us. And we were wondering about, first of all, your impression about ACC. How often have you been coming here, and what are you looking forward to this year from this venue?
Well, I think from a surgeon's perspective, the ACC has been very open and welcoming to having surgeons participate as members of the college or fellows of the college. I have been for many years. I always enjoy coming both to learn about what goes on in the adult cardiac world, as well as I have many colleagues in pediatric cardiology who are making contributions every year. And so it's a good meeting to come to from an intellectual standpoint, and a lot of good friends too.
Another question that comes to mind for us, especially cardiologists and cardiology fellows in training, there's always been this kind of historic back and forth relationship between cardiologists and cardiac surgeons. A lot of it has changed with the advent of the TAVR or TAVI, depending how you like to call it, and the whole revolution of the heart team. Can you tell us a little bit about your point of view from that perspective, and also from your position, since you have a lot of work also with the adult congenital realm, what's your take on that too?
Well, we've always had an advantage perhaps in this regard in the congenital heart surgery world, because most heart disease in children is surgical heart disease, and so the biology of the problems that the patients have bind us together. We have to work well together, otherwise the patients are going to suffer or at least not get as good outcomes as we might. The changes that are occurring in the adult world, particularly as you describe around the transcatheter valve insertions, I think represented a great opportunity for collaboration. The American College of Cardiology and the Society of Thoracic Surgeons in particular took the lead in basically drafting the guidelines for both the FDA and Medicare important because they pay, for how the TAVR should go forward. I thought that was just an absolutely terrific example of how we in the profession fulfilled a societal responsibility to try to make sure this was done in the best possible way. I think the experience in other countries where TAVR was just sort of rolled out and was not undertaken in both a controlled and intelligent, I would argue, fashion, the technology just disseminated in a sense out of control without really knowing what the long-term outcomes would be. The collaboration between the leadership at that time of the STS and the ACC was absolutely essential to making sure that this rolled out in as rational a fashion as we could make it happen. We didn't make some of the device manufacturers very happy because it was rolled out in a controlled fashion. But I do think the model of cardiologists and cardiac surgeons working together in an integrated fashion in all phases, both pre-procedure selection of patients, during the procedures, and afterwards, is really a great stride forward. It sort of puts into reality us putting the patients first, which is what we would all hope we would be doing as members of a profession. So I think it's been an absolutely terrific advance. I'm sure there are bumps in the roads in various institutions where people not used to working together now had to work together. But I think it was really it's really a great paradigm. I think it's something the surgeons have actually been asking for quite a long time. And I think it needs to extend into other realms, particularly the bigger realm being the coronary artery disease management realm.
Absolutely. And bringing people together is all what the fellows in training is all about. It's bringing fellows together, but also part of what the ACC and all the other societies are doing is bringing people together. And I think the more we can work as a organized team player kind of fashion, the better we will have from an outcomes perspective to our patient and their healthcare. So thank you so much for taking the time.
Great.
It was a pleasure to interview you. And this was George Ephrem reporting for the FIT Fellows in Training. You can find this video on youtube.com/fitsonthego.